Hello to everyone who joined, and thank you for joining a bit early. We will start as planned at 5:30. Thank you again.
Just let it go idle.
Yeah, it's like.
Thank you.
I think we'll get started. I'm really pleased to welcome everyone. Thank you very much for joining us. My name is Matt Beal. I'm a child and adolescent psychiatrist based in Washington, D.C. I'm the chief medical officer for Fort Health, and I'm also the chief of child and adolescent psychiatry at Georgetown University Medical Center. This is the third in an ongoing series of webinars that are being co-hosted by Fort Health and the Child Mind Institute. So thank you again for joining us. In February of this year, the CDC released the Youth Risk Behavior Survey, representing responses from young people about their health and behavior. The data was collected in 2021 and was released early this year. Among the most alarming findings of the report was the severity of the mental health crisis being experienced by adolescents in our country. Over the last 3 months, in response to this report, we've covered a range of themes from the report in more detail in order to give parents, caregivers, and educators information and guidance and practical advice related to this topic. In March, we spoke about the increasing prevalence of community violence and mass shootings and how these events can impact children, as well as how parents can talk to their children about these horrific events. In April, just a few weeks ago, we talked about the increasing evidence connecting the use of social media to poor mental health outcomes in children and adolescents, and what parents can do to mitigate some of these potential harms and to educate themselves as well as their children. Tonight, we're going to be focusing on the mental health of LGBTQ plus youth. The CDC study clearly identified that LGBTQ plus youth are facing far worse mental health outcomes than other youth. Teenagers identifying as LGBTQ plus report significantly higher rates of symptoms of depression and anxiety, as well as increased exposure to bullying and violence. Most concerning of all is that rates of suicide attempts are 5 times higher in these young people as compared with their non-LGBTQ plus peers. Importantly, the 2021 data did not include youth identifying as transgender, but transgender individuals will be included in our conversation this evening. We're very fortunate to be having a conversation with experts in the field tonight in order to share practical advice on what parents, caregivers, educators, and peers can do to better support LGBTQ plus youth in our communities, in our schools, and at home. I'd like to invite my colleagues on tonight's panel to introduce themselves, beginning with Dr. Lindsay Henderson. Lindsay?
Thanks, Matt. My name is Dr. Lindsay Henderson. I am a child and adolescent psychologist and the clinical director at Fort Health. Now more than ever, we feel strongly about our sense of duty to follow the data and openly discuss topics that may remain controversial and that some have abused for their own political gains. The recent CDC report that Dr. Beal mentioned found that more than half, 52% of LGBTQ plus students have recently experienced poor mental health. And as he alluded to, this did not even include trans people. Some people may not agree with the intent and goal of this webinar and have actually expressed their dissatisfaction to us. But we remain committed to the health and well-being of youth and their families. Our role is to provide care and education based on objective evidence. Fort Health is honored to host this session with two experts from two leading organizations, and our goal is to provide guidance based upon evidence and compassion for young people and their families. So I would love Dr. Michael Ennenbach to introduce yourself, please.
Hi, I'm Dr. Mike Ennenbach. I am the medical director of the Child Mind Institute in the San Francisco Bay Area office. Prior to this, I was on faculty for 12 years at UCLA, working with this population extensively. I was an LGBTQ plus champion identified there. I'm also president of Pride Kappa, which is the Gay and Lesbian Child and Adolescent Psychiatry Association associated with our academy. So this is an issue that's deep to my heart. It's important to know that LGBTQ plus kids are at much higher risk for developing mental health problems, including suicide, depression, anxiety, and substance use. This is even worse if they feel rejected by their peers or families. As was mentioned, this is a really important time to be talking about this, given a lot of the transphobic and homophobic legislation that's out there in the news in various states around the country. And I'm hoping to sort of discuss that in a bit here. It really increases the feelings of mental health stigma and limiting parents, knowledge with misinformation, and makes it challenging to get the right care for our kids. It's important to remember that when treating these kids, that resilience starts at home. You may not agree with everything that your child brings up, but it's important to be supportive and understanding and loving while they're navigating this path. I'll send it over to Ronita.
Well, thank you for having me. I'm Dr. Ronita Nath. I am the Vice President of Research at the Trevor Project. The Trevor Project is the leading suicide prevention organization for lesbian, gay, bisexual, transgender, queer, and questioning young people. And they offer a suite of services for suicide prevention and crisis intervention for LGBTQ young people. It wouldn't be an exaggeration to call the findings from the CDC's YRBS data a life and death issue. The fact that the CDC is reporting that more than 1 in 5 LGBTQ plus students surveyed attempted suicide in the past year, compared to 6% of their straight peers. That's a huge discrepancy. And according to the Trevor Project's research, in our research, we find that trans and non-binary young people report poor mental health outcomes and higher suicide risk compared to their cisgender LGBTQ peers. And we also know that when LGBTQ young people have access to affirming homes and affirming schools, they thrive. And so, I hope we can dialogue about ways to create those safer LGBTQ affirming spaces today.
Thank you, all three of you, Dr. Henderson, Dr. Ennenbach, Dr. Nath. I hope you all are okay if I switch to first names here for the sake of conversation. Thank you. So I just wanted to pick up on Ronita, what you were just speaking about it in terms of risk, and turn to you, Mike, and ask you just to give us an overview of what the evidence tells us about the relationship between LGBTQ plus identity and mental health difficulties in young people overall. How would you describe this sort of lay of the land for us?
Sure. I think I'd start just with a basic statement that just because you identify as LGBTQ plus does not mean that you automatically have mental health problems. Mental health problems do not cause one to identify as LGBTQ plus. I think that's a basic understanding. Obviously, the risk is increased. There's certain things to watch out for. There's certain stressors. There are things that increase the risk in this population, but they're not causal towards each other. And also, not all transgender individuals identify or present with gender dysphoria. I'll talk a bit about that in a minute. But the DSM describes gender dysphoria as having these questionings, like not liking your assigned genitalia, different things, but it also has to cause significant distress and impairment. So not all LGBTQ plus or trans kids have that.
Totally, and it's worth sort of digging into some of these connections a little bit more, right? I mean, there's really substantial evidence that the risk of developing mental health problems among LGBTQ plus kids is probably directly related to exposure to factors like rejection, like bullying, like discrimination, and even direct exposure to violence. In another recent study, separate from the CDC study, 9 out of 10 LGBTQ plus high school students reported being harassed and bullied in the last year. About 2/3 of these students report having been sexually harassed in school in the last year. So these are common and non-trivial and really disturbing experiences that so many of these young people are having. Mike, can you help us understand, for parents who may be with us tonight, what signs can they look for that might suggest that they should be worried with regard to their child adolescent's mental health, knowing that they might be experiencing some of these things at school?
Of course, I think these are things to be aware of for any mental health presentation, whether it's from an LGBTQ plus individual or not, but just noticing changes in your kid's demeanor. Are they more withdrawn? Are they not enjoying things that they used to do? Staying home and isolating more, not sleeping or eating well, refusing to go to school. These things can be indicative of mental health problems, bullying, different things like that. So it may or may not be related to gender identity, but just as a global thought, it's important to watch for these things. If it tends to last more than a few weeks, it might be time to talk with your child about seeing a therapist or getting some treatment. I think that again, getting back to the gender dysphoria piece, that a lot of kids do have a high level of distress about their identity, especially with all of the politics and news cycle out there. But that doesn't necessarily mean that they meet criteria for gender identity disorder, but they could still use support. And there's ways for us to do that, both as families, peers, and professionals.
Super, thanks, Mike. And I think we'll come back to some of those themes as the conversation progresses. Renita, if I turn to you, I'd love if you could share with us perspective on share with parents and caregivers on the webinar tonight. What do clinicians mean by the term questioning?
Yeah, so I think, it's, first of all, I have 2, kids myself, and it's very normal for young children to experiment with gender identity. By questioning in this context, refers to older children and young adults who are in the process of exploring their gender identity and or their sexual orientation.
Super, thank you. I know that this will come up as a theme again, as well as how we can clinically respond to be supportive to young people who are going through what you describe. I want to come back at this point to the central importance of parent support. And when I say parents, I'm really talking about the caregivers in young people's lives. Maybe parents, maybe step-parents, other caregivers, grandparents. LGBTQ plus youth who have strong family support demonstrate significantly better mental health and better functioning at school and in the community than young people who don't enjoy that support. As a child psychiatrist, I observed that in general, across all children and young people, those who are able to develop solid self-acceptance and self-awareness are better equipped to manage pressures at school and in other parts of their lives. And this journey towards self-acceptance is significantly shaped by their parents and other caregivers, who are typically form the core of a child support network. Although a young individual, particularly teenagers in our lives, may express or behave as if their parents' support is not so important to them, It's fundamentally important. I say that, Renita, as someone with 2 teenagers at home. It's fundamentally important, the level of support and the responses that children and adolescents get from their parents and core caregivers. Mike, can you give us just some examples, just in lay language? What are some of the foundational ways that parents can show support for their children?
Right. I think it's important to remember that your kids need your support, even if as a parent you don't agree with what the child is saying or doing. And what that means is explicitly letting them know that you love them, that you support them, and you stand by them. And then they can talk to you about anything. You should let them know this even if you're confused about the thoughts that they're having or upset about what they're presenting with, because that resiliency at home is really going to affect the outcome of your child's mental health. And in discussing these thoughts and feelings, it's important not to be too pointed and assertive. Use open-ending questions. A lot of times parents ask me, how often should I be checking in with my kid? And, there's not an evidence base for that, but, checking in every hour on the hour is not going to be helpful. So it's just important for them to know that you're there, available, and that you're standing by them, and love them.
Thanks, Mike. I think that that's every parent out there can take that advice directly to heart, I think. Renita, many of us across the country, and I think we're fortunate enough to have participants this evening from across the country. Many folks are living in places where they're raising kids in places in which sexuality and gender identity have become very politicized. What advice might you have for parents or caregivers living in environments such as what I described?
Right. Yeah. There's a lot of national debate going on regarding anti-LGBTQ rights and bans from LGBTQ content in schools and transgender non-binary rights. So that's that's the rhetoric we're hearing a lot right now, and it's important to note that our young people are hearing that too. According to the Trevor Project's research, the majority of LGBTQ young people are tuned into politics. They are aware of what's happening at the state and local levels on bans regard to LGBTQ rights. And, I think it's important as a parent to know that you have the power to control that narrative in your home. Don't shy away from it. They are aware. Don't let the media sort of, form their conceptions of what's acceptable and not. And I think, to bring that dialogue into your home, to, again, in open-ended questions, to start that dialogue with your child about, what are they hearing? Well, what do they feel about this? And then affirming always that acceptance, that support, that you will love them, that, you might not understand everything, and that's okay. You don't have to be an expert in LGBTQ identities to be the best supportive parent to your child. You have to love them and support them for who they truly are, and to just reaffirm that, and that you will continue learning and being on this path and journey with them. But yes, to bring that narrative to the home level, to talk about and have those discussions, I think are important, because they are hearing about it, and they need to be processing that, and who better to go to them than the one who cares about them a lot.
Right. Thank you. And I think, families that I work with and kids that I work with are at every stage of this process of communication and of openness and dialogue around these topics. And so, Lindsay, I'm wondering, in your experience clinically, how can parents be supportive, but at the same time, remember to follow their child's lead and not force a conversation or a topic that the child might not be ready to have? Any guidance there?
Yeah. I think that participants are probably going to pick up on a few themes here that we keep expressing and repeating, because they are so very important as humans and as parents to children, no matter what they're presenting with. And that is just demonstrating acceptance and openness and unconditional love. A child, the best way we can encourage children or teens to open up to us is to model that we're here, we're listening, and we love and accept them without judgment, even if we don't understand or even agree with their stance. So that, setting the tone and the relationship with leading with respect for your child is going to get that respect back. I think, it can be really, I want to acknowledge it can be really challenging, sometimes painful and hurtful, even for parents to feel like they're left out of sort of the conversation or the last to know of a child's kind of journey or endpoint, whatever that may mean. And that's okay to have those feelings, but it's our job as parents to sort of process that in our own way and to continue, demonstrating that openness and acceptance. I think it's also an opportunity to model just an ability to be curious about others, about things we don't understand, about beliefs that are different than ours, model an ability to sort of put language to, like other people in the world, sort of sexuality or gender identity, TV care, model that you can talk about it, you can hear it, you're open to speaking about it, learning about it. Just kind of looking for opportunity to sort of demonstrate that you're here and you're willing to have a conversation, or always willing to connect them with someone else to talk to if that should be what they want.
Thanks so much, Lindsay. Mike, I'm wondering, as you heard Lindsay's description, whether you have other advice about how to have these conversations in affirming and supportive ways with our kids.
Yeah, I agree with everything that was said. Overall, I would just recommend keeping open communication, listening without judgment, and respecting your child's wishes. As parents, we should respect any ideas that your kids share about their identity and meet them where they are. Let them direct the conversation. Let them set the terms of the conversation. First, hear them out without judgment. Really listen whenever they want to share things with you and let them know that you take their feelings seriously. Always using the names and pronouns that they want you to use, even if they're still figuring out what works for them. If they change their mind, not a big deal. It can be a fluid process. Just keep letting them know that you're there for them as they process these internal changes and that you love them and stand by them.
Excellent, thanks. Coming back to you, Lindsay, you and I talk about this a lot. Parenting is never an easy job. And these conversations can be really anxiety provoking and even upsetting for parents at times. Do you have any insight into how parents can cope with their own feelings and reactions when their children are exploring their gender and sexuality, or when they're struggling with these issues?
Yeah, no, and this is a well put, a common challenge. It's hard to be a parent. As Renita said eloquently, you don't have to be an expert or a knowledge expert on this topic to be supportive. You also don't have to agree or necessarily understand. So it is, I think, first of all, important to know that feelings of, distress, upset, confusion, fear for your child, even kind of mourning this this picture you had in your head about what their life may look like, right? That is all okay and it's all normal. And it's our jobs as parents to sort of to process that on our own and to not make that the job of our child to manage those emotions. So whether that is, looking for, support resources, connections through community groups, your own therapy, other parents like you, figuring out how to manage those feelings and emotions that are totally healthy and okay, that's your job, right? And it's okay, I think, to express to children, especially as they age in adolescence, like, I love you, I'm supportive, I'm confused, can you help me learn? I want to know more. Is it okay if I ask questions? How can you help me? Like, how can I best support you? And I want to know more about this thing that I don't quite understand right now. Of course, age appropriate, right? But that again is, I think, modeling an ability to acknowledge your own kind of areas of, your own areas where you're not as confident, and a willingness to learn about others, which is applicable to just good adulthood and better kind of, living, in my opinion.
Right. Well, along those lines of all of us seeking to raise good adults, Renita, can you share some insight in how we can teach our children to be allies to their peers?
Yes, so yeah, that's a great question. I think it's really important for us to teach our children to be allies to their LGBTQ peers. Again, according to the Trevor Project's research, most LGBTQ young people experience anti-LGBTQ victimization based on their sexual orientation and or gender identity. That includes, being harassed and bullied. And part of, mitigating that and creating a safer space for LGBTQ young people is for us parents to play a role in educating our children on being allies to their peers. And that starts off again by, starting that dialogue early about LGBTQ identities, educating yourselves and your young ones on the basics of LGBTQ identities. It starts by having those conversations that we should respect other pronouns, that gender is not on the binary, that we should never assume pronouns. We should ask about people's pronouns, because we know from research something as simple as people around LGBTQ folks are respecting their pronouns, that can really help them thrive and have better mental health outcomes. And also, I think, it's important to say to our children, like, if they ever do witness anti-LGBTQ harassment, discrimination, or violence, that if they're able to call it out, intervene, stop it from happening, that's great. That's important. But we understand that's not always possible. So to provide that helping hand and support after it happens, to seek support from a grown-up, those are, important things, because they're happening on a daily basis, from small level types of bullying to, very bigger forms of like physical harassment and aggression.
Sure. Thank you. I mean, as I listen to you talk, Renita, what you're describing sounds to me like decency,
Right.
decency and respect, and a willingness to tolerate difference and to keep the autonomy of other human beings in mind all the time. So I appreciate you laying those out so clearly. Mike, is there anything that you would add from your experience?
I would just say that there's a way to make it clear that you and your family are accepting of all gender identities without being explicitly talking about it. This can include using others' preferred pronouns, talking openly without judgment about any LGBTQ plus members of your family. Relevant media that it comes up. Let's say that there's a show where a kid comes out to his parents and they're really accepting, making a statement like, it's great that they felt so comfortable about that. I hope you feel comfortable coming to me if you ever had questions about that. So there's a way to do it without just being pointed in your questions. There's a way to show you're being supportive without having to state it obviously.
All right, those are great examples. Thanks. And to everyone who's listening, I see the questions coming into the chat. I already know we won't get to all of them. We'll get to as many as we can. And we've tried with the way we structured the conversation here to anticipate some of your questions. So I hope that will be to some extent satisfying, but there's so much to cover here. Renita, I'd love to come back to you and ask you what you would suggest to parents about what they should share with other family members about their child's identity. And what about communicating with school? Does this change in any way if you suspect there might be bullying at school? What kind of guidance would you suggest to families in regarding those questions?
So I take, with regards to talking to family members or teachers about identities, I take that lead from your child, whether they want to, how do they want to be presented with their family members and with their teacher. So I think it's fine to broach that and take their lead. If you do suspect bullying, that I feel that's a trigger situation, and it's best to get the child's consent before talking to their teacher about bullying. But if it's preferable to have that conversation with your teacher, with the teacher of your child, and I know it hurts a lot when your child is being bullied, and you want to get there and protect your child. And so, if you do have that conversation with the teacher and you feel that it's still not being addressed appropriately, I do think it's fine to elevate that to the principal level, because if it's a pattern of behavior that they're experiencing, it will lead to worse outcomes over time, and you do want to be that advocate for your child. So if bullying is not being resolved, you might want to consider potentially moving them to a more accepting environment, because you want your child to thrive as a parent. So taking all actions you can, but taking that lead from your child if you can.
Thank you. I'm going to shift now from some of those sort of family-based conversations, communication, to thinking about mental health care. Lindsay, can you help us understand a little bit of the landscape? What's the role for seeking professional mental health care for LGBTQ plus youth?
Yeah, great question. So as our colleagues have laid out here, this does not mean, a child who LGBTQ child is not, equal distress or depression or struggles. And to that end, like the same sort of attention and focus needs to be paid to anxiety, depression, withdrawal, more signs and symptoms of distress. And that's what, mental health clinicians are trained to do. However, there's certainly value to, seeking out a clinician who has a particular interest or experience or skill set with populations exploring sexuality and gender identity. I don't think that this is a requirement, but it is definitely a bonus. And we know the research out there shows that strong, adult kind of role models and leaders and people in power who can reflect a positive role model for these children is a really it's a protective factor, and a clinician may be that person, or a physician. I also think it's important, to be aware that as a psychologist, the APA has practice guidelines to get updated regularly on how to best approach care with this population. And, asking people is this something you're familiar with, keep up with? For example, I'm looking at our newest and, focus on resilience and celebrating the good about this population. And, how can we shift the focus while also appropriately attending to the struggle, shift the focus to really bolster up and celebrate, all there is to be proud of and the resilience that people demonstrate. I think that there's a lot of room for support. And then in the non-professional way, so many, community groups and organizations where you can also find that very appropriate and focused support from peers and role models.
Thanks, Lindsay. Our colleagues in healthcare are hopefully getting more and more acquainted with and well-versed in how to provide the best evidence-based, appropriate, effective treatment and support for young people. Mike, can you talk to us about gender-affirming care? And can you address the concern that we hear from certain quarters that doctors practicing gender-affirming care are attempting to, quote unquote, convert children?
Sure, I think this is a really important point to make. Gender-affirming care has kind of become a trigger word and a word that's thrown around in the politics of all this now. So it's important to understand what it is. So the World Health Organization defines gender-affirming care as including any single or combination of a number of social, psychological, behavioral, or medical, including hormone treatment or surgery, interventions designed to support and affirm an individual's gender identity. So it's a large umbrella term that encompasses all these different interventions, some of which may be part of the care, some may not be. It can include things like just learning coping skills, talking through coming out, helping kids how to decide they want to present themselves and interact socially. And it can be stopped at any time. This isn't, it's not a contract that you're signing to do gender affirming care. So, and the kid takes the lead on that and works with the caregiver around that. But I can't stress enough how important it is for these kids to get both the medical and psychological care that they need during this time with support. Withholding that care can lead to very poor outcomes, including suicide, non-suicidal self-injury, anxiety, and depression. And I know as a psychiatrist myself, I approach my practice very openly with this. If I don't feel like a medication is warranted, I'm not going to prescribe a medication. And I think finding the right fit out there in the community for what fits with what your kid wants. It's also important to realize that hormone replacement and surgery can't be done under age 18 without the parents' consent. So this isn't going to happen like without you noticing things happening. And honestly, the number of times that, at least personally, I get to that point where we're talking hormone replacement or surgery isn't as common. I mean, it's not, most of what I'm doing are these other interventions first to try and kind of figure it out, sort of see how it's going to end up. So surgery is rarely part of the conversation in my experience. And I think it's to remember the same thing that we're telling parents, that it's important to listen to the kids we're treating, make them feel safe, talking through their feelings and identities, that they should feel cared for in a way that allows them to express themselves and mitigate serious risks to their health. If I am discussing medication or physical changes with the patients because they've continually repeated those things to me and they're curious, they want to talk about it, it's not something that I bring up in my practice, but if I take the kids' lead, if they want to talk about that, I'll talk about that with them. But I think it's important not to be scared of this term gender affirming care. It's actually a really wonderful thing and encompasses a lot more than what people are focusing on in terms of like hormone replacement and surgery, which can be useful at times, but it's a much broader definition than that.
Thanks so much, Mike. That was really informative. I appreciate the way you framed that. I want to ask a final question before we start to get to some questions from the audience. And Renita, the Trevor Project does such extraordinary work to really insist that we talk about the risk for suicide among young people that are the subject of tonight's conversation. And I suspect that for many of the people who joined us tonight from across the country, that's what they lie awake at night thinking about. What can I do as a parent to make sure that my child doesn't end up taking their own life? It is such a tragic and such a terribly too common outcome for young people in our country. And it's absolutely an urgency that we figure out strategies to be more effective to prevent this outcome. And I think that I'd love for you to share your perspective on some resources about how parents and other adults in kids' lives can educate themselves more about this topic, and so that each of us can do our part to make sure that not one more young person dies of suicide as a result of the treatment they're receiving based on their sexuality or gender.
Right. Thank you for that. And, first of all, if your child is in crisis, I think you need to seek help immediately. The Trevor Project, has trained counselors. So, if they need to reach out, they can reach out to a trained counselor via text, chat, or phone at any time. And so right away, this is something that's quite serious. Seek a trained counselor immediately. And you can get access to those services by going to the Trevor Project .org/get-help. And there's also, the trevorproject.org has a resource center where there's a lot of resources on how to support LGBTQ young people. So, familiarize yourself with those sources. The Trevor Project is also releasing their 2023 U.S. National Survey on the mental health of LGBTQ young people on May 1st, which has a section that outlines how loved ones can, best support their LGBTQ young people. So, definitely check that out. There are other resources too. So childmind.org has multiple relevant guides for parents. It also might be helpful to, sometimes to join a support group for parents with kids in similar situations. For example, PFLAG is a really great organization for LGBTQ people and their loved ones and allies. So, those are definitely things to check out.
Fantastic, thank you. We have we're at 64 questions from this amazingly engaged audience. I'm going to do my best with my colleagues to select a few that I think are representative of what the questions that many of you are asking. So let me start with a question for Mike. Mike, is there a clearinghouse or other resource that families can use to identify LGBTQ plus affirming medical providers? This person's insurance doesn't have such a resource. General Google searches are fruitless. Renita, you may have ideas as well. How can parents and caregivers go about finding healthcare providers that can provide great care?
It's an excellent question. I don't have probably the best answer for that. I know that, like I mentioned, when I was at UCLA, you could apply to be an LGBTQ plus champion, and that was identified on the website. I know different university medical centers and major medical centers have a similar sort of blue check mark or whatever you want to call it to say that this is something that we feel comfortable with, that we do. I don't know of another clearinghouse. I don't know if you know of anything more, Anita or Lindsay. I don't know of anything in particular, but I mean, I think certainly if you're shopping around for a therapist or a medical doctor, ask them their opinion about gender affirming care and how comfortable they are with that. Because providers have different levels of comfort with this. So you want to find someone who really is passionate about it and feels comfortable with it. But yeah, but major medical centers usually will have something like that, but that's about all I know.
We can also, as a Fort Health Child Mind Institute collective with Trevor Project, try to identify some resources like this and share this out after the webinar concludes.
Yeah,
I appreciate that, Mike. So here's another question. I'll pose this one to Renita. The participant writes, I'm in Florida and my 16-year-old transgender niece stays up to date with the news in the community and the country. And I feel like it's causing a lot of mental stress for her. She has developed a very negative outlook on the future of LGBTQ rights in America and here at home. Any advice to help talk to her about current events and to inspire more hope and positivity?
Thank you for your question. And again, we're seeing this very commonly. We saw this in our last survey findings and in this survey findings that not only are they tuned in, but they are being very negatively impacted by these bills. And I would say again to just start that conversation with them. What do they feel? What's disturbing them? What just dialogue back and forth, I think might be helpful. If you feel that this is something you are not, you don't have the training on how to work with this, I would refer them to Trevor Lifeline, Trevor Text, and Trevor Chat, where trained counselors who know how to discuss these issues, can help them through. Like, you don't have to be in crisis to call and talk to somebody about this. So, just broaching the situation if you can, but if you feel you're out of your depth, this is not something you're able to do, I would refer them to a trained counselor, because it is common. We get calls about this frequently.
Right. Great suggestion. Thank you. Lindsay, there are several questions that are similar. I'm going to sort of merge them into one, which is any suggestions you have for a family in which there may be parents with different ideas or perspectives about how to be supportive, in particular where one parent may be affirming of identity and using the child's preferred pronouns, and a co-parent or another caregiver may not be willing or may be reluctant to do that. What advice might you give to that family?
Yeah, that can be a challenge. I think, I think there is a balance of acceptance and patience for others and where they're at, and also kind of setting limits and boundaries and protecting ourselves and our children or our loved ones. So this could be a tricky thing to navigate. I think really when it comes down to it, I think all parents can agree on wanting to love and support a healthy child, right? No matter what the presenting kind of lens may or challenge may be, bringing it back to how do we best support the health of our child, and just bringing it back to sort of loving them unconditionally, and putting their needs first. If that could be a common language that may be helpful to have private conversations separate from your child, right? But among family members or spouses or partners, refocusing on like, okay, how can we align on wanting the best for our child? How can you meet me there in a way that's comfortable and respectful? How can I have patience for where you're at? And then, how can we learn together, or potentially get some help around, professional help from someone like us, right? Around how do you deal with parental conflict or different views, and continuing to raise a healthy child.
Thank you, Lindsay. There's so many good questions here. I just wanted to shine a light on one comment just following up on something you said earlier, Mike. This is from Deborah, who writes that as a pediatrician in rural Oregon, who has provided gender affirming healthcare to youth for the past 15 years, we in this field try to use language like, quote, age appropriate medically necessary healthcare, end quote, instead of, quote, gender affirming care, end quote, to work against misinformation and discrimination, which just seems like very wise and savvy. Any reflections on that? You're muted, Mike.
Call it. Sorry. Oh,
okay,
yeah.
Couldn't hear you, but now we have you.
Okay, sorry. No, I mean, whatever we need to call it to get the appropriate care, great, more power to you. And yes, I think that's like, as it happens, gender affirming care has become sort of weaponized as a term. So anything we can do to reframe it for families is wonderful.
Excellent, thank you. Mike, I'm going to follow up with another question for you. There's, again, I'm merging several different inquiries. Can you talk, and Lindsay or Renita, if you have things to add, please jump in as well. Talk a little bit about the intersection overlap between autism spectrum disorders and LGBTQ youth, and how those are, what you're seeing in your clinical practice about how these different identities and neurodevelopmental trajectories might intersect?
It's a really interesting question, and something that I'm really interested by. I mean, certainly LGBTQ plus kids have the same rate of having autism as non-LGBTQ kids. When we get into the intersection between transgender identity and autism, it can be somewhat tricky to tease apart sometimes, because kids with autism develop specific sets of interests that they get really focused on, and trying to tease that apart, if this kind of a restricted interest that they're just kind of glomming onto at the moment, versus how this is really how they're identifying and trying to be supportive. I mean, being open-minded and supportive of any or all of it. But I've had kids where they grow to be adults and they want surgery, and it can be really tricky. I think it's really fascinating, and it can be really challenging for families and caregivers, but it is something that's a challenge, because it brings a new light to sort of the focus on being transgender, identifying as transgender. Is that really how they're feeling, or is that just sort of what they're reading in the news, and so they're kind of going along with it? But it's important to be open and supportive either way, but it is challenging.
Is your experience that it's helpful to have clinicians who are really experienced working with autism spectrum patients involved in the care for these kids to help to disentangle some of these threads?
Yeah, I mean, I think most practitioners could handle that combination, but it takes a lot of patience with that, and sometimes the kids with autism who come in aren't very patient about it. And so it's just a matter of really sort of stepping back, being supportive, taking your time, kind of trying to figure it out. But I've had kids who have gone both ways. Some don't identify as trans later in life, and some do.
Mm-hmm. Mm-hmm. Right. There's a theme I hear you coming back to again, several of you, which is trying to lengthen our view here, and give time for development and for adjustment and for reflection, rather than having to react with a sense of urgency or emergency as kids are in these stages of exploration. Sorry, Lindsay, were you about to jump in?
Yeah, no, I think, Mike, your points are so strong in that it's important to remember that adolescence itself is a time of identity formation and separation from parents and family and individuation. And that from the beginning of time has always meant trying things on, experimenting with who I am, what do I believe, who do I want to be, how do I want to be perceived and kind of understood out in the world. And I think one of the really neat things about our young generations is that they are in many ways so much more accepting, open-minded, and kind than generations before them. And that allows kids, I think, to be more free with exploring gender and sexual identity, both as, a very valid kind of journey of their own, and potentially also as a part of adolescence identity formation. And, generations ago that may have looked like, long hairstyles that were so upsetting to parents of that generation, or, So kind of keeping that perspective that this is their job, and patience and kind of tolerance and respect for this developmental task. And also I think for any child, like helping them find the middle ground, right? How do we honor and explore parts of ourselves, or try things on, and seek our true identity, and also kind of taper that, right? Mike, you talked about kids getting fixated, right, and super hyper focused, and that again is another good living skill. Like, how do we help them moderate, which can be applied to all sorts of aspects of good, healthy living.
Thanks, Lindsay. And I want to continue to thank you all for the great questions and comments in the chat. I wanted to spotlight another great resource, which is shared in the chat. I'm sure our panelists are well familiar with the Family Acceptance Project, which is an outstanding set of resources for families, particularly for families who may have different family members at different places of acceptance around a child's identity. The resources on the Family Acceptance Project website are outstanding and a really great guide for families and for clinicians. Speaking of clinicians, can you all talk, and I'd love to hear from each of you. Maybe we'll start with Renita from the standpoint of risk for suicide and suicide prevention. Talk about the relationship between pediatricians, primary care doctors, caring for children, and mental health professionals, and how they can work together to support children and families.
Right. Yeah, I think, that definitely there needs to be more integration of these services. But, what we're seeing in our research is that, among those who want mental health care, which is about 80% of LGBTQ young people in our survey, and it's a sample size of about 30,000, said they wanted mental health care, but around 50 so percent were not able to get it. So I think the more pertinent question is regarding how do we decrease barriers to care? Because they're citing lack of affordability, they're citing fears of discussing their mental health concerns with providers. They're citing needing to get parental permission to talk about these issues. So I think first, how do we get young people to actually get the care that they need, particularly when we're looking at 50-60% of young people are reporting symptoms of suicide, symptoms of anxiety and depression. And so there's a clear mental health need. And, if we can get them in there and have the better integration of services, I think that would be important. And schools might be like a gateway in providing that first access to, the mental health care that they need.
Thank you, Mike and Lindsay. In your practices, how do you sort of work to bridge this gap between mental health care and pediatric medical primary care?
I mean, in my practice, I work a lot with pediatric groups. I go out and give talks and work with them. When I'm seeing a kid that I know who the pediatrician is, I'm often in contact with them about coordinating our care. There's, obviously in child psychiatry, it's been a big push of consultation to primary care model, so that, that primary care pediatricians, family practice docs have a line they can call to talk to a child psychiatrist to get advice and help. So I think that model is going to continue to grow, especially given lack of access to child psychiatrists in the country, pretty much all over, especially in rural areas, where there's just not enough of us, and we're not as available as we need to be. So I think nurturing that model will be really important going forward to help them feel supported.
Thanks. Lindsay, what are you seeing?
Yeah, so as a mental health therapist, I think just striving to provide just a simple feedback loop with pediatricians around treatment progression, goals, even just observed symptoms is a value that I hold, and something that we are really working diligently at Fort Health, and educating families and kids around why we're stronger together, right? Why treatment goes better when all kind of physicians or treatment providers can at least share the occasional little nugget of info, which is more than the status quo in many ways. So I think sort of a narrative around how collaboration and just communication is in everyone's best interest, can help can help families feel a little bit safer, easier, more comfortable with that collaboration as well. So I think the other thing is just really, as mental health clinicians, making a commitment to sort of measuring symptom and outcomes and progression in treatment with data that can be shared more easily than just sort of observations or thoughts or kind of reflections. So we have a long way to go in mental health there as far as getting to that more commitment to data and outcomes. And I think that can allow us to speak a simpler, common language with medical professionals.
Super. Thank you, Lindsay. I apologize. I think I've got an internet delay for a sec, but I think I'm back now. So I want to ask Mike and Renita whether you have any remarks that you'd like to share as we come to a close. Any last thoughts for folks who joined us tonight? Renita, why don't we start with you?
Yeah, I think, when talking about like poor mental health outcomes among LGBTQ people and suicide risk, I think it's really important that we emphasize, as Mike has already done, that LGBTQ young people are not inherently prone to increased poor mental health outcomes or suicide risk because of their sexual orientation and gender identity, but that they're placed at higher risk because of mistreatment and stigmatization in society. And we all have that power to change that at the individual level, and also school and homes and the legislative level. And it all starts with us in creating that safer space by, again, using those pronouns, talking without judgment, and doing our best to learn about the basics of LGBTQ identity. So I think the power is in our hands, and we all want the same for our loved ones, is to ensure our children thrive, and there are clear strategies on how we can do that, I think.
It can't be emphasized enough that if we can work together to reduce mistreatment and bullying and discrimination and rejection, that these mental health numbers will change. So thank you for emphasizing that. Mike, what would you add?
I would just add that just to reassure families and kids that this isn't easy. I mess up pronouns every once in a while, and this is my job. So I always talk with parents and kids, like, it's going to be slip ups. And, as long as your parents are really dedicated, they're trying their best, give them a little slack if they slip up every once in a while, because some kids would just like blow up with like one mispronoun. And, I understand that from where they're coming from, that it feels invalidating, but this isn't easy. It's just not, especially for me with using they as a singular. I'm a grammar nerd. It's really hard for me. So I think just giving everyone just a little bit of slack, trying our best, making sure that they know they're loved and supported. It's not going to go perfect every time, but we're doing the best we can, and that's all we can really do.
Thanks so much. I think that when we think about suicide risk, and Renita, I'm sure that your research backs this up and has expanded upon it, but one of the most profound factors that's protective against suicide is a sense of hope about the future. And there was a recent survey by Mental Health America of LGBTQ youth, and over 80% of youth in the survey reported they expected that their lives will get better in the future. And particularly they expected that their treatment as LGBTQ plus individuals in our society will improve over time. I hope that finding is durable in the current context. But I think that all of us have a part to play to make sure that, we hear a lot about sexual minority youth, that they're told a lot that it gets better. It gets better as you get older. It gets better if you can persist through this. And I think we can't take that as a given. We have to take an active role, each of us, in making sure that it will get better for individual kids and for entire communities. So I'm really grateful to the three of you for joining us in this conversation. Part of making sure that it's going to get better is educating, informing, and supporting one another as we try to navigate this with the kids that we care for and the kids in our families together. So really appreciate the input that all of you shared, your expertise and your commitment. So grateful to the over 500 participants who joined us this evening for this webinar. I'm sorry that we couldn't get to more of your wonderful questions, but really I'm deeply grateful for the engagement, and just wanted to remind folks that we're going to continue this series talking about issues that are so important to young people and their families these days, and really continue to try to emphasize practical, supportive strategies to move forward and to confront these challenges that we're all facing. So thank you. Best of luck. Good evening to everybody.
Thank you.
Thank you.